mastitis in cows. Would you start?
Good afternoon, and thank you for the opportunity to speak. And I'd certainly just like to acknowledge my co-authors, Chris Compton, Joe Neithammer and Libby Graham, and our funders, so the government, the Ministry of Primary Industry and the dairy industry in New Zealand. Like most other industries in the world, the New Zealand Veterinary Association has prescribing guidelines, and there are a bunch of them, but probably the one I want to focus on today is the idea that we really should have an accurate diagnosis before we start using antimicrobials. You know, is there a bacteria there? What is it? And is it sensitive to what we're about to treat the animal with? And again, similarly to other industries around the world, we're using this traffic light system, trying to encourage veterinarians and producers to move away from the critically important third and fourth generation cephalosporins and the fluoroquinolones and macrolides back down to narrow spectrum penicillin and oxytetracyclines. And when we look at antimicrobial usage in New Zealand, again, like most industries in the world, the majority of antimicrobial use is associated either with clinical mastitis therapy or with antibiotic dry cow therapy. So on an average daily dose basis, about 85% of our drugs are being used for mastitis treatment and control. So one of the obvious answers, if we're going to diagnose properly and treat appropriately, we need to culture. And if we know what the bacteria is causing disease, then we can focus our treatments, for example, focusing on either gram-positive or gram-negative spectrum antimicrobials, narrow spectrum, and hopefully use local rather than parenteral treatment. Or in some cases, we may choose not to treat at all. So chronic Staph aureus cases, repeat cases, we may choose to cull or not treat, and E. coli, for example, we may choose not to treat. But we all know that producers do not give us milk samples. We culture very, very few of our clinical cases in New Zealand, certainly less than 5% and probably less than 1%. And when we talk to producers about it, they say it's too expensive and it takes too much time to take a milk sample, bring it into the veterinary clinic or the laboratory and then get a result. So one of the options might be to actually try and get the culture systems working on farm, so quicker turnaround time and potentially lower cost approach. And this approach was developed and first published by Pamela Roeg's group, so Alfonso Lagos did a really nice job in his PhD, and so in one of the initial studies they compared just a blanket treatment of clinical mastitis cases with a culture-based system, and what they found was an over 50% reduction in antimicrobial use, a reduction in the retreatment rate, but no difference in the downstream biological outcomes. So no difference in days to cure, no difference in bacterial cure rate, no difference in recurrence rate. So, you know, really substantial reduction in antimicrobial use. Now, the New Zealand system's a little different. We're pasture-based, we get a lot more gram-positive infections than the North American systems, so we were not sure whether this approach would work in our systems. So we undertook a prospective on-farm culture intervention study. It was multi-centre, so both in the North and the South Islands of New Zealand. We enrolled 7 herds, and there are about a total of 7,200 eligible cows. The mean herd size was a bit over 1,000 cows, but very large variation. So a small herd, 225 cows up to 1,900 cows. And the clinical mastitis incidence rate in these herds on average was about 1.5% of clinical mastitis cases a month, so very typical for our systems. And the diagnostic tool we used, the on-farm tool we used, is the so-called checkup plate, and this is a New Zealand design quad plate, so there's actually 4 different media. So there's a standard blood agar quadrant, there's a gram-positive selective quadrant, that's also got chrome agar in it, a gram-negative selective media, and basically a Sabboro's, so a yeast fungus-associated media in the bottom left. And it's got, as I said, a chrome agar. So strep uberis will grow in the general media, the gram-positive media, and you get this nice blue colour. For Staph aureus, again, growing in the general media, grows in the gram-positive media, perhaps a little hard to see, but the colonies have got a nice pink halo around them. For E. coli, grows in the general media and the gram-negative media, and it's got lactose in here, so lactose splitting, so you get these pink colonies. And then Klebsiella, again, because of the chrome agar, you get this nice blue colour. So we set these systems up on farms, gave the farmers training, provided the incubators and all the consumables for them to use this system. We also gave them a decision tree, and we asked farmers to assess the rectal temperature of a cow and assess the status of the animal. And if the animal was pyrexic, so over 40, and or systemically ill, the cow actually dropped out of the study and was immediately treated with the normal on-farm protocol, which normally was oxytetracycline and meloxicam. If they were only mild to moderate cases of mastitis, a milk sample was taken and culture performed, and then we had a randomisation system where the producer just went and got the next envelope, and that told the producer whether to start treating the cow immediately with penicillin intramammary if it was a single gland, or penethamate injectable if it was multiple glands, or whether to wait 24 hours and then start treating potentially based on the culture. And if there was a no growth or a gram-negative growth, then no treatment was given and the cow was kept in the hospital group and observed but not treated. If it was a Staph aureus, they were treated intramammally with cloxacillin, so 3 times 200 milligrams daily, and or in some cases macrolides. And then finally, all other growths, basically CNS, streps and anything else, was treated with intramammary penicillin or penethamate. So we enrolled 506 quarters in these farms, of which 254 were in the standard blanket group and 252 were in the selective group, and there was some loss to follow-up. So we lost 5 quarters and cows out of the blanket group because of lack of records, and we lost 17 animals out of the selective group because the farmer didn't write down the culture results and they contaminated a couple of the samples. So this gave us roughly 250 and 230 quarters for analysis. We also looked at the compliance to the protocol. So we went and reviewed the treatment records and the antimicrobial records, and we actually got the milk samples off farm as well. And basically the farm was compliant, or the case was compliant, if the right decision was made. So the right cow was allocated to the right treatment, and if they were selective, then the right treatment protocol was followed, given the microbiology result. And the compliance varied between farms. About 3/4 of the farm, or the cases on the farms, were complied with, but the worst case down here was a bit over 60% compliance. In terms of the microbiology, this is the on-farm results, not the lab results. And as you can see, strep uberis was the most common pathogen, which is exactly what we expect. Aureus was the second most common pathogen. Remarkably, the no growth rate was relatively low, only 10% of no growths and 10% of E. coli, which are significantly lower than have been published in other studies. In terms of antimicrobial use, the way we've expressed this is the number of daily treatments per cow allocated to the study. It's like average daily dose per cow enrolled. So the denominator is the number of quarters, the numerator is the sum of the daily treatments, and you divide that through. And overall, in the control group, there was 1.2 daily treatments per animal enrolled for that time frame, compared to 1 in the treated cows assigned to the treatment group, and this is actually significant. And if we look at individual farms, you can note very big differences amongst farms in the treatment protocols. So despite the fact we define treatment protocols, Particularly Farm 2 was going off-label continually and using more prolonged treatments. But for most farms, they were using treatment protocols that were only 1.5 days in length. The other thing to note is that the control group here in red, in 6 of the 7 farms, resulted in longer treatment courses than the control group in blue. We then followed these animals up in terms of probability of retreatment. So the producers had concern that because we weren't treating animals, that there would be a high recurrence rate. And this is survival analysis, so basically one proportion means none of the animals were retreated, and then as time went on, obviously animals were being retreated. And there's actually no significant difference in the retreatment rate between the blanket group in red and the selective group in blue, although numerically you can actually see the retreatment rate was numerically faster in the blanket group than the selective group, but statistically no difference there. So just to summarise, the on-farm culture system resulted in about 20% decline in antimicrobial usage. There was no increase in risk of retreatment. The compliance was quite variable amongst farm, and we put quite a lot of effort into supporting these farmers. So my team spent a lot of time talking to the farmers, training them, retraining them, following up on a monthly basis to ensure that they complied. And yet, as you saw, the compliance was not brilliant. So it can be done, but there's a lot of effort. And in fact, about 3 of the 7 farms have continued using the system beyond the end of the study. So, you know, it can be implemented, it can be done, but takes a fair bit of effort. So I'd just like to thank you for your attention, and if I may, just put in a little plug. If anybody who's got an epidemiology background wants to come and work in New Zealand, we have an open position, so I'd be happy to talk to people. So thank you, and if we have time, take some questions.